Hi, I'm Dr. Forest-Lam. Welcome back. Today we're going to be talking about urinary tract infection. Urinary tract infection include a broad spectrum of clinical illnesses from uncomplicated cystitis to fever and pyelonephritis to bacteremia and sepsis. Pregnancy increases the risk of urinary tract infection because of dilation of the ureters. About 30% of the patients with untreated bacteriuria early in the gestation progress to pyelonephritis later in pregnancy. Pyelonephritis has been associated with premature delivery. Uncomplicated acute bacterial cystitis is characterized by a history of frequency and urgency. Typically, more than 90% of the bacteria are E. coli, the source, no doubt, from the colon and rectum. Uh, Complicated UTI is defined by the presence of one of the following: um, pregnancy. If someone's pregnant, that's considered complicated UTI. Male sex, immunosuppression, catheter or urological instrumentations, and the abnormal structure of the urinary system. Stones or functional abnormality of the urogenital tract. Acute pyelonephritis is characterized by fever, flank pain, and urinary symptoms. The diagnosis of perinephric abscess should be considered in a patient whose pyelonephritis-like illness persists with fever and symptoms not improving after uh, the usual 3, 4, 5 days of antibiotics. Diagnosis of urinary tract infection requires a urinalysis for pyuria and hematuria, or urine dipstick for leukocyte esterase and nitrites. Um, Urinary culture is not necessary for uncomplicated UTI. Uh, Microbiology of complicated UTI is less predictable and requires urinary gram stain and culture. Pyelonephritis is diagnosed by fever, flank pain, urine greater than 10 to the fifth colonies of bacteria. The pyuria of more than 10 white blood cells also defines pyelonephritis on the urinalysis. 10 to the fifth or 10 WBCs visualized on high power field. Dysuria without pyuria is in a sexually active patient should warrant consideration of STI. So you see a lot of white blood cells, but no bacteria. Then you wonder if the infection really is in the bladder. Urinary specimens of pyelonephritis um, patients characteristically demonstrate significant bacteriuria, pyuria, red cells, and sporadic leukocyte casts. Treatment of UTI for simple cystitis, first line treatment for women is troublesome with methotrexate, double strength, nitrofurantoin, or ciprofloxacin or norfloxacin. So, uh, double strength spectrum, cipro, norfloxacin, or nitrofurantoin, macrobid. Uh, Treatment for cystitis in men is as per women for simple cystitis, with the exception that one should not use nitrofurantoin, which does not reach tissue concentration to treat. Consider urological evaluation for recurring disease in a man who has recurrent has pyelonephritis. UTI during pregnancy, use nitrofurantoin. Um, One of the things is that, again, the board's very much very emphatic about the no fluoroquinolone use during pregnancy. So fluoroquinolone is out of the question. Bactrim, it's slightly controversial, but most people say at least during certain uh, uh, gestation age is okay to use. That's controversial. Um, Mild to moderate uncomplicated UTI, empiric treatments with second generation cephalosporin, and check local sensitivity having. For severe illness of complicated UTI, cefepime, 2 grams, Q12 hours, or third generation cephalosporin, or cefepime, or um, Zosyn. Virus associated urinary tract infection is rarely clinical. Fungal etiology, whenever that happens, we're dealing with a profound immunocompromise, as in people who are status post uh, chemotherapy, or has the primary immunosuppression. Even though most UTIs caused by E. coli, with people who have chronic use of antibiotic, the other bacteria become more important, namely the gram-negative bacteria of the colon, Klebsiella, Proteus, and sometimes Pseudomonas. There's in the last decade or so, there's this bacteria that's taken on clinical prominence, especially in the nursing home settings. Two bacteria can produce ESLB, extended spectrum lactamase lactamase producers. Two species, E. coli and Klebsiella. That just remember that E. coli and Klebsiella. The treatment, if someone has the best choice of treatment for ESLB producing bacteria, is carbapenem. Unlike other UTI infections, uh, it is thought that the mode of transmission can be from uh, hand to hand, hand to mouth, hand to um, you know. You can imagine the mostly happening in the nursing home setting where the patient cannot take care of the urinary daily requirements. So the important factoid are that some nursing homes requires separate room, and the two bacteria that cause ESLB, they have the ESLB capability. They produce lactamase, produce uh, E. coli and Klebsiella.